హార్ట్ అటాక్ వచ్చిందంటే లోపల దీర్ఘకాలికంగా సమస్య ఉన్నట్టేనన్నారు డాక్టర్ రమేష్. చాలా మందికి పరీక్షలు ఈ సమస్య కనిపించిందన్నారు. ఇటీవల కాలంలో గుండె జబ్బుల బారిన పడేవారి సంఖ్య పెరుగుతోందని అన్నారు. ప్రస్తుతం జరుగుతున్న కార్యక్రమంలో గవర్నర్ హాజరయ్యారు. లైవ్ లో చూద్దాం.
I now request our most honorable, revered Governor of Andhra Pradesh, Shri Biswabhusan Harichandan ji, and other dignitaries on the dais to kindly light the lamp in order to make this function a grand success. Sir, welcome, sir. Dr. Mupin, our chairman, Aamoda, Dr. Ramesh Babu, and all other dignitaries, Dr. Somaraju, Dr. Prasad Rao. సతోమా సద్గమయ తమసోమా జ్యోతిర్గమయ మృత్యోర్మా అమృతంగమయ. ఓం శాంతి శాంతి శాంతి. సర్వే జనా సుఖినో భవంతు, లోకా సమస్తా సుఖినో భవంతు. ఓం శాంతి శాంతి శాంతి. Dr. Prasad Rao. Yes, sir. Yes, sir. Thank you. I now request the Managing Director of Ramesh Hospitals, Astro Ramesh Hospitals, Dr. P. Ramesh Babu, to render the welcome address and also make a small PowerPoint presentation. Dr. Ramesh Babu, please.
The honorees of today, Dr. B. Somaraj Garu, Dr. Prasad Rao Garu, Dr. Prasad Lal Garu, Dr. Ajad Mopen, Founder Chairman of Aster DM Healthcare, Dr. Raghavendra Rao Garu, Dr. Srinivas Raj Garu, Dr. Indra Ramasubbareddy Garu. We thank you all for taking time to attend this momentous occasion for Ramesh Hospitals Group on the occasion of conducting this CME program, having completed 50,000 major cardiac procedures, including surgeries and interventions in the past 25 years. As you know well, the cardiovascular diseases form one of the major public health problems not merely because of the magnitude, and globally one-third of the mortality is because of cardiovascular diseases. In India, in the past 30 years, the prevalence has been going up, whereas in affluent countries, it has been coming down. And unfortunately, in India, because of the ethnicity and several other known and unknown factors, young population, young youth in the most productive periods of their lives are affected. And if you see the statistics, it happens almost a 1.5 decades earlier than Western population, to the extent that our Indian population have heart attacks. 50% of the heart attacks occur before the age of 50 years. The state and central governments are cognizant of these facts, and you know well, the 108 is a great initiative in the state of Andhra Pradesh, which I am sure all of us will agree that it has saved several thousands and thousands of lives who were transported in EMS with the trained staff. And this is fundamental to transport a sick patient, especially cardiac patients with the defibrillator facility and all. The sudden cardiac death is not a new thing. It is known for centuries. And this is the program realizing the impact of this disease. The central health administrative authorities have allocated in the National Program for Prevention and Control of Cancer, Diabetes, Cardiovascular Disease and Strokes, and to the tune of 8,000 crores were spent in the past 5 years. It is not only the money, more important is the awareness of the disease and to provide accessibility of medical health services, especially in the rural population in a country where urban-rural divide plays a significant role in the healthcare. When we started the hospital here about 35 years ago, after having qualified from All India Institute, we were not having even ventilators, and it was very, very difficult to treat the chest pain patients and heart attack patients, to make the diagnosis, to do any aggressive investigations like interventions. And the deficit was obviously visible, and many patients were dying on the way to Hyderabad when we were shifting them. Next slide, please. So, though it is known, with the sudden demise of these apparently healthy looking people, now it has become almost a lot of awareness, and people want to know what is the cause. Earlier people were thinking, okay, I am 40, I am 50, nothing will happen to me. Now people know that they should have at least awareness so that they can follow some lifestyle measures. And heart attacks do not happen suddenly overnight. The disease is there. For almost 20 to 30 years, the plaque starts in some unfortunate people who are genetically prone, and this plaque suddenly, for several reasons which are known and unknown, suddenly ruptures and it blocks the vessel. It is not very easy to diagnose when it is only 30 to 40% stenosis. One of the basic purposes of this CMA is to create awareness that majority of the heart attacks occur in patients with 30 to 40% stenosis, not 70 to 80% stenosis. This fundamental fact, if it is realized and it doesn't produce any symptoms, and the Indian patients, apart from having a lot of risk factors, the most important risk factor is the low quality of cardiovascular care. That is the most important risk factor. And the young people, the affection, and that is the main cause of concern. And coronary artery disease, of all sudden cardiac disease, coronary artery disease is the main cause. And these are the stalwarts having realized the impact of CAD on public health, and people have contributed lot of scientific research data, how to move forward and how to prevent heart attacks and sudden cardiac death. And these are the visionaries who trained me and thousands of people like me in Delhi, in All India Institute and G.V. Pant Hospital. And the honorees are, these three names are household in Telugu states. And probably many people, their parents or their grandparents must have got in touch to have a diagnosis or, to have the advice of these great people. Yeah, once we started, we focused on three major things. One is quality, how to provide quality services to the patients, and transparency, and how to have the technology. Vijayawada being 2-tier or 3-tier city, it was very difficult to have technology and the people who are trained. And but however, people gave us or trusted us, and it allowed us to create facility in the neighboring 4 districts. And fortunately, with the help of many of the physicians sitting here who supported us, and when we started this cath lab, Dr. Somaraju's team and Dr. Prasad Rao garu gave us a lot of encouragement, and that is the basis for us and foundation now to become or to create a sort of have a milestone here. The second was academic program. This was another focus, and almost for the past 9 years we have this DNB program, and now we have almost 20 DNB students. The third one is research. We have been into research since 2004, and we have participated in almost 28 the research studies which are approved by the FDA. And almost every molecule which is used in cardiology practice, we were part of that particular study. And most of the Indian patients, how they behave, because most of the times we depend on the Western data. So we have this, and this is how we achieved this 50,000 mark. And this is not a simple achievement. It is because of the people around us who have been working day and night with passion. Many sleepless nights, all these people have spent to achieve this. And this is the cardiothoracic team existing. Not only the existing team, people were going to peripheries, and they were staying till 3 o'clock in the night to see the OPDs and coming back. So these are the people who are going there. And then these are almost about 100 consultants have participated to achieve this, and these people have now working somewhere else. Another is technology. We have telemedicine, tele-ICU, tele-ER, tele-ambulance, and 4G ambulance now. So we can monitor all patients across the cluster, Guntur, Ongole, Vijayawada, all patients 24/7 through our central command station. We can have a live also, and the other important is the training programs which we have been giving, conducting seminars, IMA meetings since 1997, and we have conducted national and international workshops with STEMI India, and also the Telemedicon International Festival, and all these things. These are all our passion, and this made us to update our knowledge and also try to disseminate whatever is there and update what are the latest guidelines and these factors. So with this, we think that the Andhra Pradesh people have given us, the physicians, and a lot of support we had from, and we rededicate. And in fact, we got even, because of the quality, we have patients from Tanzania, from Pakistan, we have operated on these patients. And then our telemedicine in the airport helped to save this Belgian patient. From airport, we picked up and did the angioplasty for this patient. So with all these things, we are very happy to be here. And the basic purpose of the CME in the afternoon session we will be seeing. The idea is the cardiology practice has changed in the past 5 years. It is not this old cardiology where you refer to the cardiologist just to know whether the patient has got disease or not. It is, you can diagnose the mild and moderate disease and you can treat, and the critical cases can be sent to the cardiologist. So with this and
other dignitaries on the dais, delegates, faculty, friends and colleagues from the Ramesh Hospital. It's a very proud moment for me to have this opportunity to stand before you, address you. First of all, let me thank Dr. Ramesh Babu and the Ramesh Hospital's team for giving me this opportunity. I've been looking at the way in which Ramesh Hospitals contributed to the healthcare of Andhra Pradesh in the last 35 years and the sacrifice which has gone behind it. Coming from one of the most precious institution in the country, All India Institute of Medical Sciences, Dr. Ramesh Babu, like of course many of the cardiologists sitting here, took the challenge of taking care of the people of this country without looking at opportunities to go abroad and gain more. Not people like me who went abroad 35 years back. So I must really congratulate them for what is being done. And in this 35 years, as has been mentioned here, lot has been done. And we all know that. It is a pandemic, I should say, the cardiac problems. It's not even an epidemic. Lot of young lives are being lost. Every day, people in the age of 40 to 50 years just drop dead. And that is something which we have to prevent. And what is the best way to do that? It is to empower the people through proper understanding of what is happening so that they themselves can take care, which is the awareness program. And more importantly, go to the doctors who are taking care of them in the periphery. And that's what is happening today. I really appreciate, I have attended a lot of conferences where we speak to the cardiologist, we speak to the specialist. But here, we are addressing the people who are closest to the patients. That is the general practitioners. That's the best part of this cardiology upskill. It is meant for the common doctor who is there in touch with the common man. And there are a lot of ways in lives can be saved. The most important being early recognition. If you are able to recognize that there is a problem, then earlier we used to talk about golden hour and all, to wait, within 1 hour to give treatment. Now we speak about platinum opportunity, which is just 10 minutes if you can give proper care. And that is something which will be highlighted in this conference. I don't want to prolong. I just want to tell that this association with Ramesh Hospitals, which started 7 years back. I remember coming here to see the Guntur Hospital at that time, which was just coming up, and witness our past president, Dr. APJ Abdul Kalam, inaugurating that hospital. That's when we decided that we should go along with Ramesh Hospitals. We are fairly a large organization. We are spread in 7 countries. We have 26,000 people working with us, 3,500 doctors, 7,000 plus nurses, seeing about 20 million patients in a year. So fairly large operations, but this is one of the associations that I keep very close to heart. Because in Andhra Pradesh, what I see sitting outside India is what is happening is going to the people, closer to them, through telemedicine, through peripheral centers, and lot of things which we are not doing in other states where we are present in India. That is something which is making me very happy that we have this association. I just want to wish Dr. Ramesh Babu and the whole team all the best in their endeavor, and the Honorable Chief Minister of this state has been in the forefront of taking healthcare to the periphery, to the people who are in the villages. And that is a journey in which we would like to support Dr. Ramesh Babu and team, where we are now planning to start our pharmacies, labs, and of course telemedicine centers, and come closer to the people. That journey, along with Ramesh Hospital, will give the access to the people who are there in the periphery through the different schemes that the government has rolled out, including the central government scheme of Ayushman Bharat. I am sure that we will be able to save hundreds of lives as we go forward. The life expectancy of Indians have gone up from 40 to 78 or 75, over 75. And we are all having healthy longevity now, but that has not reached the villages. Let us try to do that. I once again thank you all. May God bless. Thank you. Jai Hind.
Thank you very much. That was a brief but very effective, heart-touching presentation by Dr. Ajad Mopen, a Padma Shri awardee. Thank you very much, Dr. Mopen. Now, friends, we move on to another very pleasant part of the function, that is felicitating three luminaries in the field of cardiology. Dr. B. Somarazu, Dr. Prasad Rao, and Dr. I.A.V. Prasad Lal. May I now request Dr. Somarazu just to move towards our Honorable Governor, Andhra Pradesh. Sri M.S. Ram Mohan Rao, Chairman, will honor him with shawl. Dr. Ramesh Babu, MD of Ramesh Hospitals, will honor him with bouquet. And our Honorable Governor of Andhra Pradesh will present him the memento. Thank you very much, sir. Thank you very much. Now, on behalf of the cardiology luminaries receiving the honors, the felicitations from the hands of our most revered and honorable Governor of Andhra Pradesh, on behalf of all the three, Dr. Somarazu, the mentor and patron of cardiology, will now address the gathering. Sir.
Good afternoon to everybody. Honorable Governor, distinguished dignitaries on the dais, and distinguished audience. We thank you very much for recognizing what we would have possibly done and our contributions. I just want to say a few things about on the occasion that we are all here. The medicine we practice is supposed to be safe, efficient, effective, patient-centered, timely and equitable. That is considered to be what is the right way of practicing medicine, the way medicine should be practiced. So I must congratulate Dr. Ramesh Babu for making all that possible in the last 24 years, 25 years. It wasn't easy at all, and it's not easy now. Then, as I said, Dr. Ramesh mentioned that we played some role in trying to make it happen. In the initial days, me and my colleagues, Dr. Prasad Rao and his colleagues, we did play some role in the initial stages, but most of it, what was carried on, belongs to Ramesh and his colleagues. We can almost say, in the language of cardiology, you were just played an ectopic role coming from Hyderabad. Ectopic means extra beat in the heart. So after that Ramesh took over. You know, extra beats are not useless. There is what is called post-extrasystolic potentiation. So after extrasystole, this heart beats more strongly. That's what Ramesh did, and congratulations Ramesh, continue. Thank you.
It is the heart that spoke. The big heart which has saved many hearts. Thank you very much, sir. Thank you very much. Friends, a poet, a writer, an advocate, and a warrior on corruption, and a statesman, and above all, Kalinga Ratna, Sri Biswabhusan Harichandan Ji, Honorable Governor of Andhra Pradesh, will now address the August gathering. Sir, may I request you to address this gathering of Cardiac Update Summit. Sir.
Dr. M.C. Das, Dr. India Ram Subbareddy, Dr. M. Raghavendra Rao, M.S. Ramman Rao, Dr. Ramesh Babu, Dr. Azad Mopen, Dr. B. Somaraju, Dr. Prasad Rao, Dr. IAB Prasad Lal, Dr. Srinivas Raju, distinguished guests, members of the print and electronic media, ladies and gentlemen, my warm greetings to you all. It gives me immense pleasure to participate in today's conference on Cardiology Update Summit, organized by Ramesh Hospitals. It is said that heart disease is the world's biggest killer, causing 90 lakh deaths every year in the world. It is estimated that around 5.5 crore people in India have some form of cardiovascular disease, and 1/6 of the diabetics in the world are in India. Accordingly to the World Health Organization, 1 in 10 people in India is prone to cancer. It is alarming to note that the infectious diseases are quite rampant in the country due to lack of good hygiene practices and sanitary conditions. The Sustainable Development Goals set by the United Nations in 2015 call for a 1/3 reduction in premature mortality from non-communicable disease by 2030. These include cardiovascular disease, chronic respiratory illness, cancer and diabetes. According to the global burden of disease, nearly 1/4 of all deaths in India are due to CBDs. In our country, about 1/3 of the senior citizens have been diagnosed with hypertension, 5.2%, with chronic heart disease, and 2.7% with stroke. According to a study in our country, the mean age at which people get the first myocardial infection in 53 years, which is about 10 years earlier than our counterparts in developed countries. With the increased consumption of processed and energy intensive food and dependence on machines for physical work, the urban population is more in danger of getting heart ailments than their counterparts in rural areas. Behavioral factors such as smoking, alcohol use, low physical activity, and insufficient consumption of vegetables and fruits also contribute to the high number of CBDs. According to a recent survey, the major causes of death in Andhra Pradesh state are due to lower respiratory infection, heart disease, TB, diarrhea, low birth weight, and accidents. All these studies point towards the need for preserving the traditional lifestyle as an important factor to lower the incidence of CBD. Regular exercise is the best way of maintaining a healthy weight. Having a healthy weight reduces your chances of developing high blood pressure. Regular exercise will make your heart and blood circulatory system more efficient, lower your cholesterol level, and also keep your blood pressure at a healthy level. The doctors' fraternity and the staffs associated with them, that they have saved the country, and India's contribution to the world is also in the matter of this pandemic, COVID-19 pandemic, is unique. With this, I also like to speak something regarding the role of the doctors. What should be the role of the doctors? I like to write a story from Ramayana. In Ramayana, as you know, that when there was war between Ravan and Lord Sri Ramchandra, Ravan had struck a very deadly weapon towards Lakshman, and Lakshman almost fell down and found as if he is completely dead. What is the remedy? Then Biswabhusan said, that there is only one physician who can save his life. When Lord Sri Ramchandra asked, who is that physician? He said he is the royal physician of Sri Lanka, Ravan's physician. It is something strange that when war is going on between Lord Sri Ram and Ravan, how the royal physician of Sri Lanka will come to save Lakshman. Then Veer Hanuman said that, where is he? Where is he living? Gave him the description of the building where Susen, the great physician, is living. Bibhisana had given the description. And thereafter, Veer Hanuman went there, located the building, and found that the great physician Susen was moving inside the building. He took the entire building and came here. And when Susen came, he asked Lord Sri Ram, you are Bhajjata Purushottama. Please tell me that you are the greatest enemy of my king, Ravan. And he has killed his enemy. He had struck him with a deadly weapon for killing him. Being his physician, is it my dharma to cure him or take up his treatment? Bhajjata Purushottam, Lord Sri Ram said that doctor, physician is like a god before the patient. He has no enemy. He cannot consider whether he is a friend or an enemy. Its duty is, whenever he finds a patient, whenever he finds that somebody is fighting for life, it is his immediate duty to treat him. So, he has no consideration before him whether he is enemy or friend, because he is God before the patient. And that is the role of a physician, and that is dharma. And hearing this, then Susen said, Prabhu, I am very much obliged that you have told me what should be dharma of a physician, and he made the treatment, as you know, and Veer Hanuman, how to take an entire Gandhamadhan mountain and taking Visalakarani, he saved the life of Lakshman. On return, when Ravan came out to kill him, he said that being my physician, how could you venture to go there? And if you were taken, how could you treat him? Then he said that I asked Lord Sri Ram, and he said that this is the duty of the entire society. Help the society without caring whether anybody is rich or poor, because the downtrodden people of the society are not getting the proper treatment now. In spite of these several schemes launched by the central government and also the state government, poor people, downtrodden people are not able to come to the hospital. And if by any means they come to the hospital, and because of lack of funds with them, they are not getting the treatment. And my appeal to you all, behave in the same manner as Dr. Susen has done, and always have that compassion for these poor and neglected people, make that treatment, and Lord will have His blessings on you. Thank you all.
That was an excellent message of dharma to the medical fraternity. Friends, our Honorable Governor deserves a standing ovation for that wonderful message which will go a long way in, well, saving the lives of the people and also giving Mahabhagya, that is Arogyam. Arogyame Mahabhagyam. Sir, we are very much honored with your wonderful message. Thank you very much, sir. Thank you very much. Friends, now we will have the great opportunity and the rather special privileges of honoring our own first citizen of the state, Honorable Governor of Andhra Pradesh. I request Dr. Ajad Mopen, the Chairman of Astor Healthcare, Dr. MS Ram Mohan Rao, Chairman of Ramesh Hospitals, and Dr. Ramesh Babu, the Chairman of Managing Director of Ramesh Hospitals, to honor our Chief Guest, Most Honorable Governor of Andhra Pradesh. Shawl will be presented by our MS Ram Mohan Rao, Chairman of Ramesh Hospitals, and bouquet will be presented by Dr. Ajad Mopin, and the memento will be handed over to our Honorable Governor of Andhra Pradesh, a poet, a writer, a statesman, whatnot, and believer of Dharma, the essence of all religions. Dharma is the essence of all religions. And our Honorable Governor is a great believer of Dharma. May I now request our unit head, Dr. Sudarshan, to propose a formal vote of thanks. Dr. Sudarshan.
Respected dignitaries on the dais and off the dais, good afternoon everyone. On this Sunday, the 29th May 2022, I humbly stand in front of you as the representative of the 2,500 member strong family of Astor Ramesh Hospitals Group. I wish to propose vote of thanks and express our sincere gratitude to the august gathering assembled here, a privileged duty and an honor for which we are extremely thankful to the supreme powers that be. I wish to thank one and all for the tumultuous success of the Cardiology Update Summit today. I'm confident that the exchange of thoughts and experience through this summit would benefit the medical fraternity in general and the young and budding cardiac specialists in particular. On behalf of Astor Ramesh Hospitals, I express my hearty gratitude to the respectable, most honorable Governor, Mahamahim, Kalingaratna, Sri Biswabhusan Harichandan ji, for kindly accepting our invitation and for his graceful presence at today's summit. Thank you very much, sir. Honorable Governor's words of encouragement, his expressed good wishes and kind blessings would be a source of inspiration to us. We would be thankful to his officers and staff of the Raj Bhavan. Our special thanks to the three greatly acclaimed luminaries in the field of cardiology and cardiac sciences, Dr. B. Somaraj Garu, Dr. D. Prasad Rao Garu, Dr. I.A.V. Lal Garu, Prasad Lal Garu, for your august presence today and for accepting our humble felicitations, sir. my duty to thank Dr. M. Raghavendra Rao Garu, Director of Medical Education, for representing the government of Andhra Pradesh. Dr. Indla Ram Subbareddy Garu, Member, AP Medical Council, and the observer of today's CME. Dr. C. Srinivas Raj Garu, President, Indian Medical Association, State of Andhra Pradesh, for gracing the occasion. I express my thanks and gratitude to our Honorable Chairman, Sri M.S. Sita Raman Rao Garu. And thank you very much, Dr. Azad Mupen sir, for your presence today and your kind words of appreciation and greetings and blessings to our team. Thank you, Dr. P. Ramesh Babu Garu, the man of the day. We appreciate you. We thank you for your vision, your leadership, and the humane services that you have been rendering over the past 3.5 decades, sir. Thank you once again. Last but not the least, thank you very much, Dr. M.C. Das, sir, for your eloquent way of conducting the whole program. But for you, it wouldn't have been a success, sir. Thank you so much. Thank you once again.
Wonderful. Thank you very much, Dr. Sudarshan. Shall we all stand up for National Anthem, the conclusion of this inaugural session?
जनगण मन अधिनायक जय हे भारत भाग्य विधाता पंजाब सिंध गुजरात मराठा द्राविड उत्कल वंगा विंध्य हिमाचल यमुना गंगा उज्जल जलधि तरंगा तव शुभ नामे गाहे तव शुभ आशीष मांगे गाहे तव जय गाथा जनगण मंगलदायक जय हे भारत भाग्य विधाता जय हे जय हे जय हे जय 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 हे.
Let's all stand and give a big ovation to our Honorable Governor for his gracious presence and a wonderful message to the medical fraternity and to the invitees. Sir, thank you very much, sir.